Now, in terms of scar presentations, there's so many different kinds. It could be like this person. This is actually the mastectomy scar here, down here, but this is so restricted in fascia. The scar has, probably underneath the skin grown. It's not part of the visible scar, but then it's created this incredible ridge. So all of this is restricted down here, and this is fluid buildup all across here. So if this person walked into your treatment room, she's in a chronic phase of healing. What would you want to do with her? Where would you start? Pop it in the chat. Yes, moving fluid, lymph drainage. Absolutely. Moving fluid out so you create less tension in the tissues is really wonderful. Yeah. And then into the fascial restrictions for sure, especially around in this area, really doing some gentle shearing, lifting, skin rolling, everything in here to try and create the ability for fluid to move through here. And then in this whole area, moving up towards the supraclavicular, infraclavicular region, up and towards the medial nodes here. So moving fluid and fascial restrictions. Scar presentations are many and varied. It depends on whether they stay flat or they get reconstruction. So what you've seen here, this is horizontal scars. The lady on the previous slide, she had oblique. Sometimes they are separate, like this is separate, but sometimes they actually go all the way across and they are connected, or they just have like half an inch of unconnected tissue here, like a little isthmus between two legs. So the scar comes almost all the way across, but not quite. Delayed reconstruction is definitely possible. So staying flat may not be their end point. It's just, a stop along the way. It's like one of their train stations is flat, then they get on the train and they keep going and they get off at reconstruction. If they are getting reconstruction in the future, then we can work with them to prepare for that surgery so that they have healthy blood flow, a robust lymphatic system that can stave off infection. Their nervous system is nice and calm. They're mentally ready to prepare and receive another surgery into their body. They're kind of on board, their range of motion is good, strength has been restored as much as possible. We're creating a healthy environment so that in their next surgery, they're able to acclimatize to it, integrate it in as easy a way as possible.